Hey there, this is Patty again. We're going to go over Ventric placement and then monitoring ICPs through your Ventric. First of all, your physician says he wants to put a Ventric in, and you kind of freak out a little bit, but then you pull yourself together and you go get your brain cart. In your brain cart on the bottom, you'll have your cranial access kit, which is the big box that'll have your shave kit and everything else in there. You'll also get your Ventric catheter set. There's 2 in there in case one is dropped or anything like that. And then there's also the Ventric drainage system, and that will that's your bag right here. So the first thing we want to do is to get ready while the doctor's getting ready, and that is to prime our tubing for our pressure tubing to monitor ICPs. We'll get our pressure tubing, and in this will remain sterile. We'll open up a syringe sterilely. This one wasn't. And then also draw a needle for some saline. Remember, this is the brain, so we need to use preservative-free saline and not our saline flushes. You'll put your sterile gloves on. Again, we do this sterile because of the brain and the chances, and this being a direct line into the brain, the chances of infection are higher. If you have a buddy with you, they can help hold the saline, or I can show you how to, we'll show you how to do that. So first of all, you hook your needle up to your saline. You come over, it's already popped. Push your needle in and tip upside down and draw out your fluid. And you put your needle in too far, like I did, and you're gonna have to have your buddy pull it down so you can get the rest of the fluid out, because you're probably gonna need the full 10 cc's. At that point, you just take it off there, have your buddy take it off there. And then you have your preservative-free saline in a sterile syringe. When you open up your pressure tubing, you'll have your 2 things there. And you'll want to get rid of the stuff that goes to the bag. Now, we used to prime a bag. We used to use a bag and prime it. And I want to try to get away from that. So this is why I'm showing you the syringe technique. So we're not going to use a bag. So we're going to get rid of that. We're going to throw that away. Also, on the bottom here, we don't want to have an access port, an extra access port. So we're going to get rid of that also. Maybe. Okay, so now this should be all that you have. At this point, you're going to grab your syringe and you're going to attach it to the top here. You'll push your syringe through, your fluid through, and you're going to open it up so you can push through this. Right? Here, and then you'll push through the rest of your tubing. Remember, you're going to have to pull this tab to push through, right? You should get rid of all of your air bubbles that way. We'll cut this tab when we're done. We don't have to worry about it right now. So we're going to do this. We're going to recap. And then we're going to grab one of our other caps from here and cap this end. And that is going to allow us to not have the bag actually hooked up. So you'll see you're capped, you're capped, you're capped. While you're waiting for your physician and to keep this clean, you can cap this other end too. And that way you don't have to remain sterile. You can help your physician then put the actual Ventric in. So you can cap this way. And then you have that all set up and ready to go. Your physician will then put in your Ventric, and this is it. This will be sterile also along with this. He will then, at that point, uncap and connect here. This will be your drainage, so you'll be able to see CSF fluid, right? Because this will be off to this pressure, it'll be open up to the catheter that's in the brain. So you'll be able to see CSF fluid go through. Once that is done, then your physician usually secures it, puts a dressing on it, and leaves. It is then at your point where you come in and you have to do this. So remember, this is capped right here. So you'll take that cap off, and you'll take this cap off, because this is your pressure cord, and you'll hook it up. Remember this, like with anything, any kind of pressure, you have to have a phlebostatic access, right? And so for the brain, it is at the tragus. You will then go and hook your cord up to your pressure box in the back here, maybe, or this one. How about this one? Okay. Oh, this is, it's not going in. Or you'll get a cord that works and plug it in. And plug in here. At that point, you'll get a waveform on the monitor. You'll have to zero as you would to anything. So again, when you zero, you have to go off to the patient, correct, right? And then you'll open up to atmospheric pressure. You'll zero, and then you will turn back on to monitor. This will then have to be open to the brain, right? So it's going to be off to drainage and open to the brain to monitor that pressure. We do spot checks. Sometimes we can keep both open. If we did, we could do that. The only problem with this is that it's going to give you a reading that's going to be competing against the brain and the drainage bag. So we prefer not to do that. We would prefer to do spot checks with the ICP monitoring if we're draining continually. If we're not draining continually, then we monitor the ICP and only open to the drain when we need to relieve pressure in the brain by getting rid of cerebrospinal fluid. So also leveling, your physician will tell you, remember this is to the tragus, so they'll tell you if they want it at 10 millimeters of water or centimeters of water or millimeters of mercury. Make sure you ask that because every patient is different and every physician is different of how they want this done. Remember not to turn upside down because once this valve, there's a valve in here, once it gets wet, it won't drain anymore. So you have to watch that and to turn off your Buretrol. It will come like that, so just make sure you turn this off so you can get a collection and you can monitor how much you actually have taken off. When you go to transport your patient, remember to turn this, you can do this two ways. You can turn this off to the head, that way it won't drain at all. And then that way you can put this in the bed. You can move the head of the bed up and down, and then you won't have to worry about draining too much fluid or anything like that. If you have any questions, your physicians will definitely help you on this portion of the insertion, but they will not know how to do this. So watch these videos or ask your friends or phone a friend or something. I think that's it.